I have a little bit of a controversial opinion. I don't think doctors should be able to prescribe medication.
Okay, tell me more.
Because they're not experts in it. They listen to salespeople all day, but they're not experts. Imagine, because the pharmacist is the expert. The pharmacist does a PhD and does all of this time and learning drugs and all the interactions, which has the most severe side effects. They are the experts. So it seems to me that the doctor should be on a prescription pad, should be writing, here's the problem this person has. You know, I want to prescribe something for strep throat. But they shouldn't be picking the drug. The pharmacist should be, because the pharmacist is the expert on it.
All right. No, this video is an insult to our medical training, our physicians. And I'm going to start by saying that I work with pharmacists directly, and I love pharmacists. And I think, unpopular opinion, or maybe a popular opinion, I think it's a popular opinion, but doctors should team up with pharmacists to help better optimize patient care and to better treat patients and to have a collaborative practice agreement with a pharmacist so that we can get patients on the right medications, watch for side effects, and do all of these things. So my opinion, we need to team up. We need to collaborate. Pharmacists should be integrated into our care system. However, I am going to circle back. Physicians, we are experts. We have been trained in all of the medications, in all of the side effects. That is part of our education. That is part of our residency and our fellowships. And that is literally things that we study. We study pharmacology, right? We are experts. We are medical doctors. We are experts in pharmacology. We are experts in diagnosis. And so to try and take away a physician's ability to prescribe a medication that we know the symptoms, we know the diagnosis, we diagnose the patient. A pharmacist cannot diagnose a patient. So you're telling me that a physician who has been trained in the drug-to-drug interactions, in pharmacology, in the mechanism of action, I can sit here and tell you the mechanism of action of every medication I prescribe and what those side effects are and where it's metabolized by. And these are things that I do every single day. Now, if you ask me a medication that is not within my wheelhouse or not within my expertise, you're right. Maybe I should ask my colleague who is an expert in that field. And maybe I will call the pharmacist and say, hey, can you help me out with this?